right law students to figure out the legal aspects of our employment law project, employment project for migrant workers. And fingers crossed, hopefully this will be an even bigger success than our previous health project. So it's great to finally see everybody. Like Priyanka said, names were familiar. So it's good to finally put a face to them. So over to you, Siddharth.
Thanks. Eklavya.
Hi everyone, I'm Eklavya. So I'm a first year student. I've just finished my first year. Student at OP Jindal University, and I'm studying liberal arts. And I found out about Siddhartha reached out to the university for volunteers, and that's how I came into this. And I was initially doing content development for the website, the initial pages, city pages and state pages for the website, and then now I'm doing the social media, and I'm on the social media and marketing team. And yeah, I'm glad to meet everyone finally, face to face.
Thanks. Ratna?
Hi, everyone. And I've known Siddharth for over a decade now, and we've worked on several things together. So I know how he takes things forward. I was also part of the initial team when this whole idea was conceived, and we worked together on the city pages, also developed the Swasthi project. And it's nice to see such a big team. I didn't know there were so many people working in the background. So great to meet you all, and look forward to many more successful projects.
Thanks.
Over to you, Siddharth.
Thanks. Neha?
You're on mute. All right. I was just wondering if it's the other one. Hi guys, I'm Neha. I've been with the project for a while now. I think I'm assuming a little after the co-founding team started it out, and it's been interesting. My background's not been of the development sector, but I think we've been working with the marketing and social media team for a while now, and it's interesting to see our work sort of come to life, and with the new projects coming in and the survey starting, it's just a lot of new things happening. I've actually seen my team for the first time today. So yeah, thank you for the call, Siddhartha, because I hadn't seen the team that I'm working with. You only talk on the phone. So this has been nice, and I can see them smiling here on the call. So yeah, thank you. And it's good to see all of you, actually. It's really nice to finally see a lot of people we've been talking to, but hadn't really met. So yeah, thank you.
Sriram?
Hi, everyone. Thanks for joining in, and thanks, Siddharth, for inviting me to this meeting. So Siddharth and I got in touch in the month of April, just a couple of weeks after the lockdown. And back then, we thought it would be, at least I thought it would be the 15-day lockdown, and then things will be back to normal. But COVID had other plans. And Siddharth had this foresight to start a platform. And it was not like a blip on, it's not like a fundraising effort that takes off and then, three weeks down the line, things are back to normal. So he had this vision to create this platform. And thankfully, it's been a more sustained effort spread over 2-3 months, right? So I'm really thankful to Siddharth, and also thankful to all the volunteers and our students who are doing some great work with Siddharth. I work with Jindal's Career Services Office, and primarily just support. I'm like the principal cheerleader for Siddharth more than anything else, and try to support him with whatever I can do with the Jindal community and with also the other networks that I'm part of. And right now we have our alumni task force, the JGU COVID alumni task force, who's also, we are also trying to get them to support Siddharth and Priyanka in their mission to sustain their efforts against this COVID crisis that's imposed on our daily wage workers. And I will have to rush off in 10-15 minutes, so please excuse me if I drop out in between.
Thanks, Sriram. So, Kapil.
first of all, congratulations, Siddharth, for bringing up such a big team together. Yeah, it's quite difficult, to get such a team on board and working with everyone remotely. So, yeah, congratulations to everybody also, because everybody wants to learn something and want to give their best and want to make things happen. So I'm also one of them. So I wanted to associate with such a non-profit for a long time. So now I got time. So right now I'm working on corporates to see on the survey so that we can get maximum responses, and also with the social media team will be joining them soon. And work-wise, I'm working with a Japanese company in marketing and PR department. So yeah, I'm looking forward to the effort and to make it a success. Thank you, Siddharth.
Thanks, Kapil. So over to Ronak.
Thanks, sir. I hope I'm audible.
Yes.
Yeah. So I'm a student at Sri Venkateswara College, Delhi University. I'm studying statistics. So naturally, I'm going to be helping with the data analysis part of the surveys that we conduct in other areas. I'm currently, until we get the data, I'm working on helping us get in contact with organizations which can help grants and funding. So that we can that can jumpstart our projects. So yeah, I'm glad to be here. I recently joined, so glad to see everyone and hope to move forward.
Thank you. I believe we have Sumati next.
Hi everyone. I'm Sumiti. I'm a lawyer by profession as well. I actually went to law school with Priyanka, so I've had a very long association with her. And it's through her that I got to know about the platform and the work, and the great work that you guys are doing. And once I got to know that they're looking for people to help out with the review of the labor laws, I was very eager to help in whatever way I can. I work with a law firm in Delhi. My work is primarily based on infrastructure law and corporate work, but I've had some exposure to labor laws as well, and helping ILO with review of the changes in the labor law that have been happening in India in the past, for the past some time. So I'm here to help with that and any other way that I can. I've only recently associated with the project and look forward to a good run.
Thank you. Sharmi.
Hello everyone, I'm Charmi, and I just completed my first year at University College of London, and actually that is how I know Divya, who is who is a member of this platform already, and she told me about this, and I said yes right away because I wanted to join and see how we can stay at home and then still do some work for migrant workers, and it has been a really great journey. Like, I've been working on stories related to different issues to migrant workers or summaries of reports, and I've really enjoyed it. So yeah, I'm really glad to meet you all today and look forward to working more. Thank you.
Thank you. Divya.
Hi everyone, I'm Divya. I study social sciences with data science at University College London. That's where I met Charmi. And I joined Daily Wage Worker platform in mid-June. And I joined because, I've been moving around the country, moving around, continents for a while now. And, migration is something that's been an important part of my life. And for that reason, I thought it'd be, great if I could help people going through a similar situation, but in a much more dangerous and much more difficult context. So since I've joined, I've been a part of quite a few teams, including website design, webinar planning, and currently the report writing team. So you'll find that the Daily Wage Worker family is full of supporting, intelligent, and interesting people, and we can't wait to work with you.
Thank you. Tanushree.
Hi everybody, I'm Tanushree and I'm currently in my second year in OP Jindal Global University, and I'm currently pursuing liberal arts. I've been involved with the platform since April, which I started by researching for city pages. And since then, I've done almost anything that involves content writing or research. And I'm currently involved in the report writing, which will be released soon. And I hope will be a good report. And I'm really excited for it. When the lockdown was imposed, I personally, to say the least, was very disheartened to see the plight of the workers. And when Siddharth approached our university with such an opportunity, I don't think I could turn it down. So I'm very excited to see where this goes and to work with all of you. It's been such a pleasure.
Thank you. Who just joined on iPhone? Sorry, I can't see your name.
Hi, Siddharth. Ridhima this side. I joined from iPhone.
Hi, Ridhima.
Yeah. So my name is Dr. Ridhima Vora. I did my medicine from Delhi University in homeopathic medicine. And I'm a public health specialist with graduation from Tata Institute of Social Sciences, Mumbai. I've worked with many organizations in designing their proposals like UNICEF, IQVIA, and Directorate General of Health Services. So public health is my area that, I really look forward and extend my help in any way that I can. Currently, I'm working in CTS Tech as a healthcare business analyst. It is a US-based IT firm. So I'm really thankful, for Siddharth and the other team members for, making me a part of this initiative. And I really look forward to work with them. I've joined Daily Wage Workers a month, almost 21 days back, and I'm working in the health program support. So thank you, everyone. Really nice to see you.
Thank you. Okay, great. So we do have a presentation for you, a little bit about the Daily Wage Worker, what we've achieved in the first 100 days. Some of you know it, some of you are very much part of those 100 days. So it's always good to see your own work being represented. So while we get, Eklavya shows the presentation, I'll just give you a little bit of background. So, we started this, Priyanka and I, with just the two of us, as an idea which came to being in March. I think it's 24th March when the lockdown started. And we saw the panic that was taking place in Delhi with the bus stops and all these migrant workers, and it was getting bad to worse. So I think initially, I think Priyanka also helped some migrants to go home, and we gave some grants through various websites. And then suddenly we just felt that we can and we need to and we must do a lot more to help these people, because we are in a privileged position where all in our homes, safe, secure, and there are not tens, there are not thousands, there are millions, there are lakhs of people who are on the streets. They're walking 200, 300, 400 kilometers in 30, 40 degrees Celsius without food, without security, without even a glass of water. And I think you've all seen the level of desperation, the challenge of this massive crisis that has hit our country and impacted so many of our people. And so we came together and said, we have to really take action, and we convened a group of committed volunteers. So Uma was there at that time, and we also had Ratna who was there, and many others who joined us. And we came up with this idea of having this platform where initially the idea was to just document what was going on, because it was very hard to know what was happening in India with the workers because of the lockdown. So there was some information on WhatsApp groups and Facebook groups. So we created this platform, and then we were like, now what do we do? So then I got a call from Shriram, who's here today, and he asked me some questions. And he was like, I'm going to give you 10 people from tomorrow to get this platform going. I still can't believe, actually. The next day, this email arrived from him, and he had 10 CVs there. And I think, all of you or most of you from that group are all here today even. And so this is really your work. It's your platform that you have created. I mean, we had the vision that, we want to support these India's 65 million migrant workers and give them access to food security, healthcare, and help with their livelihoods in this COVID-19 era. And then also really saying that, their socioeconomic well-being, which is the informal sector workers, which are 90% of India's workforce today, is really integrated into the SDGs. Everybody talks about the Sustainable Development Goals, but this missing invisible workforce doesn't seem to feature in it. So that is something that we are very conscious of and really trying to make a change on. Next slide. So
Hello, Siddharth. Can you hear me?
yes.
Oh, great. I'm so sorry. I think I lost connection. I'm in a secluded part right now, and I barely have any network.
Is that Jayender?
Yeah. Yes.
So Jayender, why don't you go ahead and introduce yourself?
Yeah. So, hello everyone. I'm sorry you can't see me because I think Airtel forgot to put towers in my area, and so I started working with the Daily Wage Worker online platform 1 week after Eklavya, and I saw the mail by Siddharth, and I think somehow it went into my spam box, and I was like, how did I miss this great opportunity? So I contacted Siddharth directly, and he welcomed me with open arms, and I think I have been working with the research team and the content writing team since 1 week after the online platform launched. And currently I'm working with the report writing team, which is a wonderful team, and I think we'll do a great job with the report. And it's finally great to see everyone who's involved in the project. So thank you, Siddharth.
Thanks, Jayender. So so basically, what is the mission of this very new organization? It's to collate the information of the relief efforts by various stakeholders to support migrants and daily wage workers. And we wanted to promote networking amongst governments, corporates, NGOs for better coordination, scaling up, because I think it's a very challenging situation. And yes, the government can do a lot more than it is doing, but just blaming different sectors doesn't help. So we really wanted to see what is positive coming out of all the work that some state governments are doing, like Kerala, what some organizations are doing from the private sector, like Zomato, what some NGOs like Goonj and individuals and resident welfare associations are doing. So we started to put this together, and it was really, I think the initiative of the Jindal University students who are here today and have been here for the last 3 months, who have put this whole platform together with a lot of dedication, a lot of hard work, a lot of research. As you probably have seen, this website has, I think, 200 pages of research that has been done by the students very diligently over the past few months. And I really am very grateful to them, because this is going to have a lasting impact to document the work of 200 relief efforts from across the country, from Orissa to Bihar to Telangana to Hyderabad to Bombay to Delhi to Gurgaon. And then what we wanted to do was actually, catalyze multi-stakeholder action to address these basic rights to food, health, livelihood, and the informal sector. And then we wanted to test innovative business models to prove that, healthcare, legal aid, employment can be accessed through these workers. And we address holistically all their needs. So starting with food security during the lockdowns, then looking at developing emergency healthcare packages for these migrants in their slum situations where they cannot get out, they cannot reach primary healthcare because, as you know, our hospitals are also overflowing with patients. And then eventually, post-lockdown, creating jobs, employment, livelihoods, legal counseling and awareness, skilling, so that, we can look at a robust 360 holistic approach to addressing the migrant worker crisis. Next slide. So this is our team. So we have the platform coordinators, which is myself and Priyanka. We have project partners, research and content team, projects, strategy, marketing, website development. Next slide. So I think all of you are listed here. I know a lot of people could not make this call today, but we just want to acknowledge, all the work that everybody's done. It's been really phenomenal. So, we really have some brilliant people who really dedicated a lot of time and effort to this cause. On the research and content development side, we have Divya, Mohit, Mariam, Siddhant, Tanushri, Jayender, who's here today, and a lot of people who have joined recently. Shami is also here. Really kudos to you for putting in all the hours, effort, research to doing this. On the SWAS team, we have Isha, Ridhima, Preeti, and Tanurina, who really put this project together, and Abhinandan was also helping us with this, so thanks for that. The big Rozgar project, which is quite a challenging project, because we're looking at legal aid, we're looking at skilling, we're looking at matchmaking workers and employers, We have Sumati, Abhinandan, Neha, Arushi, Sunny, Anya, Manya, Ira, Ronak, Akshay, and Shraddha working on this. From our strategy team, which is really experts advising us on what we're doing well, what we're doing wrong, what we should do better. We have Ratna and Uma who are here today with us today, and we thank you for your advice. You will see we have a very, very dynamic marketing and social media team, which is led by Neha, Eklavya, Jasma, and started by Hokun. And then we also have a sort of back office website development team, which is putting all the stuff on the website that you see today. Next slide. So our partners, we're very grateful that in the last 3 months, we had, of course, Jindal University that started us off, and Shoreview Consulting, which is a consulting firm based in Australia, which supported us to create this platform in the first place. We also have our donors, so a media network, which is funded SWAST, and the Swiss Development Corporation, which is co-funded SWAST, and our NGO partners. So we have Don Bosco, Smile Foundation, Dharavi Diaries, Operation Asha, the Medics, and Gurgaon Nagarik Ek Manch, and many more are joining hands today to take this forward. So we are very excited about going forward. Next slide. So what have we really achieved in our first 100 days? We've documented 200 relief efforts from across India. We've raised $50,000 to feed 30,000 workers in Dharavi, and this was in April. Next. In May, we started Project SWAST, and we've created an emergency help package for 30,000 migrant workers across 3 regions, and we have also managed to raise 23 lakhs for this project so far. And from June, we've been working on the Rozgar project, which is providing employment and legal awareness for migrants with very robust NGOs, both in the migrant locations like Mahashakti Foundation in Orissa and Don Bosco Network in the South in Kerala that is bringing the employers on board. Next slide. So this is a little bit about, I think when you go into our website, you'll see we have managed to actually capture what 15 state governments are doing in response to COVID for migrant and daily wage workers. On the other side, you see 17 cities. So you go to our pages and you'll see there's a lot of work there in terms of what's happening in Gurgaon, for example. There are lots of NGOs working on this. There are individuals. The police is involved. The municipal corporation is involved. Zomato is involved, and many more. So we've documented that across the cities. Next slide. Currently, we are working as a result of putting all this information together on an analytical report. So as you know, the lockdowns are, the initial lockdowns have closed. So we're doing a food security report to assess the impact of the food and ration relief efforts during the lockdowns on feeding the migrant and daily wage workers. So we are doing a lot of desk research to look at what are the corporates, non-profit and government organizations, what methods did they use and how did they deliver the rations to the workers. And then we're also trying to do an impact assessment by actually talking to these organizations. So we have shortlisted from across the country 90 organizations that have been involved in relief work for migrant and daily wage workers. And these come from NGOs, these come from corporates and from state organizations. And the team is doing desk research to find out, what impact has their work had in terms of providing relief. And they're also calling up some of these organizations to personally speak with the management and understand, get insights into what happened so that we can document this in a report in the coming weeks. Our next survey is a social media survey, which is basically on SurveyMonkey on social media. So you can click on it and basically it's trying to see, as individuals, what kind of relief work are you providing to daily wage workers? So we'll understand, as individuals, your background, your motivation, your experiences in volunteering, contributing, donation. So do share your information with us, take this survey and help us also document the kind of support that you have provided to these workers in these difficult times. Next slide. So I'm going to hand over to Priyanka now. She's going to talk about the projects that we are doing right now.
Thanks, Siddharth. So, like Siddharth said, we wanted to address the most natural but also the most urgent problems, which we thought, the migrant population is facing and became the natural cause. So, while we were documenting the relief efforts which were happening across the country by civil society, NGOs, and government, we also wanted to directly be involved in certain projects which directly affect the migrants. And that's when we collaborated with this NGO called Dharavi Diaries. They were working in Dharavi, and Dharavi that time was the worst affected area pretty much in the country because of the density of the population and the size of the population. And that time, I'm sure you all remember, the cases in Bombay were multiplying at a very high rate. So Dharavi was absolutely blocked. People could not go out. And if you're not going out, you're not working, of course, and they hardly had any money to even buy food for themselves. So Dharavi Diary was working to provide food and ration kits to 30,000 workers in Dharavi. And that's when we came together and we ran a very, very aggressive campaign online, which you'll see in further slides, what are the activities and events we did. And we were able to raise about $50,000 US to feed these workers. And the fundraising was not just, focused or restricted just to India, but it was across several countries. So a few countries in Europe, US, and even Hong Kong and Singapore. So it was a very successful campaign to raise that amount of money, for organizations newly set up. It was a great success. And next slide. So going forward, you'll see what kind of projects we did, the events we did under the Dharavi project. I'll request Neha Rao to talk about our social media promotions and the events we did to support the Dharavi project.
Thanks, Priyanka. Dharavi was, of course, quite the hotspot at that time, and we were trying to get help from literally all over the world, like Priyanka said, and people were actually very generous. So we decided to, of course, there was a traditional approach of sharing pictures from the ground and things like that, and literally in terms of what we're sharing with the people there. And we also had a lot of involvement with younger people.
Residents
So
of
if you
Dharavi
see the video, you'll know. Yes, Eklavya, could we have the video?
Face a much greater threat. As the lockdown in India continues, they find themselves fearing starvation more than the virus itself.
परिवार सब घर पे बैठे हैं, खाने को ठिकाना नहीं, क्या पगार भी नहीं, कुछ भी नहीं मिल पा रहे हैं, खाने का भी जुगाड़ नहीं है, पैसा नहीं है, नहीं तो गाड़ी चलाने का
Dharavi Diaries, a project under the Gyanodaya Foundation, is dedicated to distributing food kits to daily wagers in Dharavi. Daily Wage Worker, an online information platform, is helping to raise $100,000 US for Dharavi, which will be used to distribute rations to feed 50,000 slum dwellers for 14 days. The survival of daily wagers in Dharavi is now dependent on charitable work, kind hearts, and organizations such as Dharavi Diaries, which could use your support. With your donations, we can feed some of India's most vulnerable daily wage workers. Please donate generously.
Thanks, Eklavya. We also had, we launched a campaign by the name of To Dharavi with Love, where we actually had a lot of international artists collaborate with us and appeal to their audience across the world for donations and to just basically support the campaign that we've been trying to do. So we had a musician from Switzerland, we had a jazz singer from New Orleans in the US, we had Ambi Subramaniam, we had a Bharatanatyam dancer from India, and we also had a star Debu perform for us. And it was, all of them combined were actually really beautiful, very, very different. And it was very overwhelming, the kind of support we actually got from everyone. And we'd like you to see a small clip where we'll show you, a small, it's just a small clip with all of them together. So it'll be nice for you all to just get an idea about what was done. Eklavya, could we have the next? Thank you.
World is slowing down and it's been more than just some weeks. There's something in the air that's making us a little weak. But hope amongst the thousands is a remedy we keep close to our hearts and pray for better days to breathe.
Is love, sweet love. It's the only thing that bears us to let love. What the world needs now is love, sweet love.
Thanks. Priyanka.
Thanks, Neha. So, like I was saying earlier, we decided to look at the most natural areas where we could help migrants. And the starting point was food security. And we raised funds, which was $50,000. And you saw, it wasn't that simple. Our team got us people from all over the world to perform and help us raise that money. And once that was done, we also knew that the other most important need the migrants will have and their families will have, especially who are stuck back in the urban slums and who couldn't go back or have been living in these urban slums for several years and do not have any ties back home, and a mixed population, did not have any avenues for healthcare. And even if you don't have COVID, the other diseases are not going anywhere from India, and India has a huge disease burden. So a lot of regular, serious, non-serious diseases will keep happening. If you have regular asthma checkups, regular TB checkups, if you're suffering from cancer, that's not going anywhere. If you need dialysis for your kidney. So we decided to launch an emergency healthcare project for 3 months with 3 partners or partner organizations, and which you saw in the previous slide: Operation Asha based in New Delhi, Medics based in Odisha, and Smile Foundation based in Hyderabad. The idea, the aim of the project is to target a population of 30,000 people in 30 slums in 3 different cities. And our NGO partners who are implementing this project are working in 10 slums each to offer help. And the emergency package offers, a health package offers diagnosis, screening, counseling, hospital referrals, but also a medical and a sanitary kit, which has essentials and free supplies for sanitary pads, basic medications, and hand sanitizers and soaps. And also a lot of people are, suffering from a lot of mental health issues, especially after losing their job, etc. So if they need counseling, if they need any screening, and all this is being done through telemedicine, mobile vans, because our implementing partners had this experience in the past. And if somebody, a specific person in the slums needs a referral to a bigger hospital, our NGO partners are even providing that. For these projects, we applied for funding to different donors, and very successfully we secured funding for Operation Asha from Omidyar Network and from Swiss Development Agency for Smile Foundation. So both the projects are already in the implementation stage, and our teams are working very actively on monitoring and helping the implementing organizations with the projects. And we're still fundraising for the Orissa organization, the medics, so that we can kickstart that project as well, and that's underway. Next slide. And we've done aggressive promotions on social media. When an organization is new, it's very difficult to have an outreach which other organizations can have. And when you have something like COVID, of course, it takes over all the news. So it was very important that we do make a lot of effort towards social media, because how else do we have an outreach to people? And if you're doing such good work and we have such good teams, it's also important that people know what's happening. And that's why how we get more people involved. And that's why our social media team has been a crucial part, and they've been working towards, making posts and promoting the work which Daily Wage Worker is doing with other partners. And in that, we've also done webinars with important partners. I can have the next slide. Yeah, we've done webinars as well.
The global pandemic and the recent lockdown in India has affected the daily wage worker community in unimaginable ways. With no work and barely any savings, they are struggling to manage basic meals for their families, and healthcare seems to be no priority. What if we told you that you can help them lead a healthy life? Yes, you can do something about it today. Open your hearts. Donate an emergency healthcare package for a migrant worker for just Rs 1.5 per day. The emergency health package will provide migrants with screening, testing, counseling, medicines, and referrals. The project will be implemented using telemedicine and social distancing. Project Swast. Help us empower 30,000 migrants from 30 slums in 3 cities to be able to lead a healthy life. Safeguard a life. Donate now.
Yeah, thanks a lot, Eklavya. So you've seen the video, and to talk about our project and also to promote what work we're doing, we also did a webinar with our partner organization so that they can tell everyone about how they've launched the project and what challenges they are facing, what success plan they have for the project. And we had a good turnout for this webinar. And before I go to the other project, I also wanted to briefly tell you that in these 4 months, we've seen a lot of success for some, a platform which is absolutely newly launched. But we've also faced our share of challenges, and in Swasthya, we saw that where we were able to raise funds for 2 organizations, another organization, Medics, which is extremely competent organization run by doctors. We're still working towards raising funds for that. And that's, we also wanted to share, what few challenges we were facing when we were working on these projects. Next slide. We did another webinar where we wanted to showcase how civil society's response to the migrant worker crisis had made so much difference across the country, and everybody, each one of you have seen that. And I think one reason why each one of you got involved with this platform is because that's how, you wanted to respond to the situation. You wanted to bring in your contribution to this crisis. And in this webinar, we had, members from Gurgaon Nagrik Ekta Manch, volunteers from SWAN. It's also a new network which was launched after COVID to help stranded workers across the country and mostly in South India. And Father Noel from the Don Bosco network. Next. This is our third project. Siddharth had introduced it briefly in the beginning. So obviously, when we try and take care of food security, health, rozgar, employment for migrants is the most natural step, and also a long-term solution so that we help them enable so that they can make an earning for themselves and take care of their needs. And in this project, we have two partners, Mahashakti Foundation and Don Bosco. We are also partnering with the Jindal Global University as COVID response group, which is a group made of alumni and some NGOs. So they would also be collaborating with us in this project. Next slide. We decided to do this project in a few states to start with, because our NGO partners are based in Odisha and the south of India, which is Kerala and Tamil Nadu. But with Jindal, we'll be expanding this to other states as well. And a lot of migrants have lost their jobs and gone back home, but a lot of them also decided to stay in Delhi. And like I said, a lot of this, the urban slum population, the migrants who've been in, for example, Delhi or Bombay for 30, 40 years or for 2 generations, do not really have ties back in their villages, are also here. So they're stranded at both places, and we decided there's no just one solution to their employment problem. So what we in our project are trying to do is do employment matching, understand what work they've done in the past and how, if we can find potential future employers to match their employment need. For example, you know, there has been news that a lot of construction companies now are stuck because their work is not moving forward because a lot of workers went back. So understanding from our NGO partners which workers have what skill and matching that with the employers. Our NGO partner Mahashakti also does a lot of work in skill building. So that's the next phase of the project, that we work with migrants, and if they want to build any skills, and need not necessarily be like a long vocational training, but somebody who was a construction worker but now wants to work in a small time restaurant and wants to learn cooking. So also enabling them with training skills. And then the most important component of our project is legal awareness, legal training, making the migrants understand their rights, their entitlements, so that they can negotiate better. They know when, God forbid, something like this happens again, or there's some other crisis, what their entitlements are, and link them to several government schemes. And for this, we are partnering with the Jindal COVID response group. And our, like I said, and so we'll be developing a proposal to do fundraising for this, but all our partners have already started work on this, and we have a big team which is developing legal materials on this, and Sumiti and Abhinandan are leading this and mentoring this project with a group of students. And the legal products which we want to develop for these trainings and awareness campaigns, we want to develop them in vernacular so that migrants can understand that, and do trainings with them and with local NGOs in those cities. So these are our 3 projects. 2 are already being implemented, and the third one we're already working on. And also on the sides applying for funding so that we can have a longer and a larger impact. So yeah, we've raised 60 lakhs in 100 days, and we need your help to raise another 50 lakhs. It's huge for an organization which is not even exactly 4 months old, but now we've set up as a trust in India. And if our impact together, working with all you guys, is 60 lakhs in 100 days, then 50 lakhs doesn't seem impossible. It's difficult, but not really impossible. So I think, Siddharth, do you want to take over and say a few words before we end this presentation, and have our partners say a few words?
Yes, so I wanted to really acknowledge and thank, as I have, all our contributors to Daily Wage Worker. This would not have happened without each and every one of your contributions. And also welcome the new team that has joined today. We've grown from 2, as I said, to 10 to 30 today. So it's a very exciting time. I think we can achieve a lot going forward. I think we've also discussed with individually, which teams you'll be working on depending on your skill set and your interests. But collectively, we are a group of 30 right now. As Priyanka said, we are short of 50 lakhs. It's a tall ask, but I feel that if all of us come together, and if all of us could spend maybe an hour a week helping us with the fundraising efforts, we could really have a major impact. And this could be, that doesn't mean that we're asking you to either donate or get someone to personally donate lakhs to this cause. What we're saying is you are part of a process. So even things like documenting a list of NGOs or creating a list of donors, there's so many corporates that are doing CSR today. So getting a list of that to us, going on LinkedIn and finding the CSR managers for these corporates, writing to them, all these things can really help. Researching on what are the different organizations that there's a lot of COVID relief out there, from CSR, from government schemes, from public-private schemes like the Media Network, which has funded us already. They put out a grant right now for crores. We're also applying, but it's going to take time. And I think, if everybody contributes to fundraising in one way or another, whether it is actually helping us connect to donors, to publicizing our work, to writing proposals, to getting us media spotlights, because the media really doesn't know that Daily Wage Worker exists. And I think, that kind of awareness would definitely drive more and more people to support us and take us, we take baby steps to bigger steps to really reach a scale and have an impact on the ground. Because as we said, the task is really immense. But given that people do have tremendous confidence, I think, in the team that is here today, as we've seen by the fact that we managed to raise the 60 lakhs, I'm very confident in the next 3 to 6 months, we will be able to reach that 50 lakh target. But we would really, seek your support and dedication to doing this, because every penny is going to the worker. It's helping feed them. It's helping give them healthcare. It's helping them getting jobs. It's helping them understand about their legal rights, because as you know, there are a lot of government schemes that can help them, but they don't even know about them, let alone being able to access them. We've seen in the COVID crisis, there's so many employers who just did not pay their workers in such an acute crisis, and they got away with it. So by educating these workers, by helping them, connecting them to lawyers, supporting them with NGOs, we can really have an impact on the ground. And our idea is to start these pilots and take them to scale, so that, we start with these 30,000 figures that we have shown you today, but we really want to go to 30 lakhs. We really want to reach the people who need it, to develop models that can be scaled up, so that we really have an impact on a very big scale, on the impact of 90% of India's workforce. That's huge. And each one of you here can really play a very significant role as a volunteer, as a fundraiser, in your technical capacity, as lawyers, as health specialists, as monitoring and evaluation people, as communications people. If you see our social media team, I think we rock. So with that, I'm going to hand over to some of our special guests today. So I think we have a short video from Brendan Shaw from Shoreview Consulting in Australia.
Hello, I'm Brendan Shaw from Shoreview Consulting. The COVID-19 pandemic has given rise to many tragic stories around the world as nations around the world cope with it. But none more so than India, where we've seen enormous issues, particularly in the migrant populations and migrant workers moving out of cities, and the amazing issues that have been dealt with across the country. Shoreview Consulting has worked on health policy issues in India, and so it's been an opportunity for us to give something back to the community of India through our support for the Daily Wage Worker platform. I've been particularly impressed with the work the team's done in putting the platform together and in creating the platform of stories, support services and information available to migrant workers throughout India to help them get through these difficult times. So I'm very pleased that Shoreview Consulting has been able to contribute, in a small way at least, to this by supporting the development of the Daily Wage Worker platform. We're really proud of that, and we look forward to working with the community in India in the future on this important issue and to improve the health of Indians in the future.
Thanks. May I also call on Ratna Devi to say a few words?
Hi everyone, can you hear me?
but we can't see you.
Okay, wait.
So Ratna gave us Project Swast. We're very grateful for the idea of coming up with this emergency health package. And she's been enormously supportive and mentoring us through, one crisis after another internally within Daily Wage Worker. So we are very grateful to, all the support you've given. Over to you.
Thank you, Siddharth, for your very kind words. I try to give the time that you require from me. I think I would have given much more, only my other work, my bread and butter work keeps me so busy that I've not been able to really contribute. But having said that, I think Project Swast is a great initiative, a great beginning. I just gave the idea, but the team took it forward. I remember the numerous conversations we had, trying to go back and forth on what would be the best sort of formula that could actually be innovative, but still meet the needs of these migrants. And I'm so glad that we have funding for 2 partners. I hope you get the funding for the 3rd one as well. And as you said, there's tons of money floating out there. I think you really need to curate all of that and start putting your proposals together, because COVID is now the new sort of buzzword for which everybody is trying to fund. And I think the healthcare package as well as the the livelihood package will be winners. So you just have to persevere and keep chasing the donors till you get the money. Any other crisis, I'm always there to provide a solution to the best of my ability. Also, any networking that you want to do, I'm there to provide that kind of support as well. So I'm happy that, you thought of me when you actually started this whole initiative, and I'm glad I could give my little bit. So back to you, and thanks so much for making me a part of this initiative.
Thank you. Maybe I'll also call on Sumiti to say a few words, because you have been guiding us with the Rozgar project.
Hi. So I think the workers being aware of their rights in the first place is, an informed worker is a prerequisite to having him able to, lead a better life, whether it is in terms of accessing opportunities, health, otherwise taking decisions. And in India, the situation of workers in general is honestly not great. The enforcement of labor laws is very poor, and it's made poorer because of the lack of knowledge. So I think it's a great initiative to have this project where, because of this situation, we have realized even more the importance of informing the workers of their rights, so that instead of just up and running away from a situation, they can stand their ground and find the solutions where they are. And I know Abhinandan has been working on the labor law aspects, and I had given some guidance earlier. And I look forward to working with the team and taking it forward in terms of putting together material that makes sense for the worker, because it's one thing to be talking about legal rights and constitutional rights in a way at a very esoteric level, and it's another to translate that legal information for a worker to access it and digest it in an easy manner and then implement it. So we'll put together the information bit and also look forward to reaching out to labor lawyers and NGOs who can actually help guide these workers when they find themselves in sticky situations. So looking forward to working with the team on this, and thank you for the opportunity.
Thank you, Sumiti. So I'd also like to call on Neha Malik, who's just joined us, to introduce herself. And she and Arushi have been working on a very challenging but a very, very important survey about skill sets and employability for migrant workers. So maybe they can tell us a little bit about that. Over to you, Neha. Can you everybody turn their cameras on so we can see you?
Okay, hi Siddharth, thank you. It's just my network is in a very poor shape, and that's how I'm not able to turn on the camera. But I'll just see how it works out. But thank you for the opportunity for letting us work on this project. And I think Arushi and I have been, interacting and talking with each other on developing the questionnaire. And I think it has been, as of now, a very good experience. And also Tarina, who has been a part of the team, has given us very extensive feedback. So right now, Arushi and I, we are trying to wrap up the feedback and the work on the input and try to finish up the first draft of the workers questionnaire, so that the Mahashakti NGO partner can start at least the pilot, and then they can continue with the survey. So yeah, that's good. Arushi, to you.
So I don't think I have anything other than that to add. I mean, just started working with Neha and it's been really great. There are some new things that I haven't never really worked with before, so it's interesting. And everybody have been a great help. Siddharth, Taruna, they have really great inputs, and so far we're just developing the survey and see how it goes and works out at the end. But that's it. Just adding it to what Neha said. That's what we work on at the moment. Over to you, Siddharth.
Great, thanks. So you've heard a lot from, I think, a lot of the core team inside the Daily Wage Worker platform, what we're doing, what our projects are, and so forth. It'll be nice, actually, if we spend the next 5 minutes maybe hearing from you, our team that's been there for the last 3 months, in terms of what you see as the milestones that we've achieved, what we should do more or less of, and also some of the newcomers who've joined us in the recent days and weeks, where you feel we should focus more or less on, or what you'd like to do. So over to you guys. Divya.
Siddharth.
Yes, Kapil, please go ahead.
So I was going through the whole project and the strategy, and yesterday I shared the one of the media report. So I was thinking we should more craft our stories in a way that we could highlight ourselves in the media itself on the communication front, as we are in the unlock 3. So it's everybody's looking for the employment. So now we need to craft a survey in a way, or talking to the corporation, how their efforts has really paid them off, or actually the workers, how they are going to get them, what kind of skills they have given them, and now what kind of companies they are going to be employed with. So such kind of stories are going to be in the media in coming times, and what kind of efforts they have done, that's great. Now what all these effort going to pay off on the health front also. I think we need to give more efforts, or maybe in our teams someone could do it, or craft some stories, or contact a media person. I'm trying to connect with few CSR journalists so that I actually get the idea what's going on in the market and media, what kind of stories they are looking after. So maybe in survey questions, while we are connecting with the corporates or governments, we can add things going forward, how we are going to do with that.
That's a great idea, Kapil. Any other thoughts?
So I think I'll just start. So you asked about milestones, and I think this presentation that we have today, that was a pretty significant milestone in itself, because first off, it shows all the the culmination and accumulation of all the work that we've been doing so far, and the fact that we are presenting to such a large and diverse team of volunteers. I think that's a really great achievement. In terms of going forward, I would say that we are really occupied with a lot of work streams, and that's really good, especially for a platform that has only just begun. And I think I am just really excited to see so many people on board, and it would be great if we could work together in a streamlined and harmonious fashion, or to achieve our goals. I mean, I think what we're doing is great so far. I think we should just continue it going forward. So yeah.
Thanks. Tanushree.
I don't think I have anything to add because whatever we're doing has been going very smoothly and brilliantly, and we always have projects after projects coming up. And as Divya mentioned, I think we should work in a streamlined fashion, and that's going to be so great for our platform. And just seeing this presentation today, just as a visual proof of what we've been doing since I've been involved with the platform since April, was such a pleasure, honestly. So that's all I have to say.
And audiovisual guru Eklavya.
I don't know. I mean, as of now on social media, we're doing where the objective is to aggressively promote our survey for this week, and that's. I mean, we need good responses for the survey because I mean that's what will make up our report that's ongoing, and so that's the aim now. Post that, Neha had some ideas she was running by me regarding some to get responses from universities, circulate the survey around universities in Bombay, Delhi, and since we are students and we have a network. So yeah, I think for now that would be a good thing that we should look forward to. So yeah.
So over to Neha.
No, I think a couple of things. I think Kapil's point is very valid, and we've been talking about it, Siddhartha, and we've been trying to get, now that we have a body of work, I think it's, you can sort of go with a lot of confidence to people and tell them the kind of work you've been doing, and, you'll have journalists interested in what you're saying because there's proof of concept here now as compared to how we started talking about it in April when it was more an ideation stage. So we're good in that sense, and now I think now's the time to sort of now try and talk about it because we have things to say. Second, I think a dedicated corporate outreach is important from what Priyanka was saying, and I think maybe independently, especially the senior people on the team here who've been here for a while and have been working in various fields should probably get together every week and try and get that in a streamlined fashion. I think it could help because for example, I'm busy with the other work also. So there are often, where things sort of slip at the, people, but the minute somebody asks me, I can tell you I know, but it doesn't immediately hit me that I could connect you. So, so you have a message from me on your WhatsApp and you can see it later and I think you'll be happy about it. But that's number 2. And I think that's really important for us to sort of get going. Number 3, again, I think it would be nice to get a few more professionals, senior members from the industry to sort of start coming in because the direction always helps the younger team that we have. And that sort of, I've seen that it's really helping move things forward in a more streamlined fashion well, because then you have people working with teams like that. So I think it's been great. And what we've managed to achieve actually is also fairly surprising too. It's just been 100 days. So yeah, in both terms, I think there's always more to do. So yeah, that's something we can work towards.
Thanks, Neha. Uma?
I think a little bit of media coverage is definitely needed, and we need to actually sell out the stories that we have about how we managed to do our fundraising to tell a few media people. I'm trying my best to tell a few people. We had one article out in Times of India recently, and I'm looking forward to other publications who may be interested in telling us some, covering us, because the more people read about you, the more they think about you, the more they understand that they are ready to participate in being part of you. Otherwise, I think this team is doing just wonderfully. I think, considering it started only 3-4 months ago and the energy level, and I agree with what she said earlier, the one that we should have maybe more senior people from different walks of life who can give us different kind of energy in our product. That is very important because they'll take us to different directions. We need to be everywhere as well. we need to reach out to as many people as possible. Thanks.
Ratna?
Do you need my camera back on?
Yes.
Okay, give me a minute. Okay, I think, everybody has spoken about everything, but there's a big missing link with the government. And unless you are known within the government circles, you won't really get the recognition. A lot of good work being done with the private sector and with NGO partners and everybody else. But I think there's a missing connect with the policymakers and the government. And I do understand it's too early, it's very young organization, but I think the sooner we start, the faster we make the connect. So because there are a lot of discussions already happening within the government, which are now being open to civil society, I think daily wage worker platforms should find some means of getting a seat at the table in those discussions and in those platforms. That will really put you up at the forefront of discussions and also give the credibility to the platform. That's my little bit of advice.
Thanks a lot. Ronak?
Yeah, so I think like everybody has covered everything, but being a tech guy, the only thing I would suggest or want to see in the future would be trying to create a platform, a digital platform in the form of a web application or a website where we directly connect people who are facing issues with solutions to that, instead of just having an informative website as we have right now. So that's something that needs to be worked on by a very large team, and obviously that's something we can only work on, at a later stage. But other than what everybody has said, I think that's the only thing I can add on to that.
So are you talking about a mobile app or what kind of?
No, a mobile app is obviously a much more difficult task to take on. A web application is much simpler and it can help connect more people.
How would that work in your experience?
Okay, so a web application, there is an example of that. A student I know him, he has created a web application which connects disabled people to companies which help disabled people get employment. And so it basically creates a database, and it helps connect those people to organizations which help them and to companies which help them. So that's the kind of application which helps improve our reach as well.
Okay, great. So we'll follow up with you. So any other comments from Neha Malik, Arushi, Sumiti?
I just wanted to, not a new point, but what Ratna said, that it's very important that now we start developing our relationships and networks with the government. And, even if we are a new organization, we can also start working with state governments to start with. And like she said, if we've done a lot of work, say, for example, in Orissa or in Delhi, we should be part of those discussions which are happening within the government. And it brings a lot of credibility to our work, our organization, and increases our chances of funding also. Because especially in this government, this current scenario where we have this government, it's very good, fortunate that, you have that credibility and you're working with the government. Donors are always open to funding organizations like that. And we've been lucky to find great people to work on strategy and project implementation, with our health partners and our Rozgar partners as well. But what, all of you do together gives all this work a big push. So Operation Asha's work or a Smile Foundation or Rozgar will not happen unless all you guys, the social media team making those posts, or, Ratna, Uma helping us conceptualize everything, and all of you working together. So communications, fundraising, relationship building, these three things give such big pushes to all the projects, and only then we are able to implement them actually. So yeah, I think like all of you said, we do need some, media coverage. That again improves our chances of fundraising, because if we are there in the media, I have seen it personally, just ran one story in NDTV many years ago for a mother and a daughter. And in 20 days, we had 12 lakhs for them. We opened a trust. And now the girl who was a construction worker's child works in studies in Sri Ram Vasant Vihar. So media coverage can really do wonders. So yeah, request all of you, and like Siddharth and I are always thinking about it and working towards it. Get some communication, so media coverage, and keep thinking about fundraising. You have random discussions with friends and family and parents, and if you think of something, somebody takes names of some organizations, or you think if there's some fundraising discussion happening, just note it down, follow that up and help us, let us know. We'll help you and we'll see where we can take it.
Thank you, Priyanka. I just wanted to add one point to Dr. Ratna's and Priyanka's point is, for the policymaker perspective, while the platform is trying to connect with the government and the policymaker, especially member of parliament, I would be able to support the network to do that, because my prior work was with the member of parliament, also focusing not only at the legislative level but also at the constituency level. So if we are focusing, given we are doing a survey at the state of Orissa, Tamil Nadu and Kerala, I've already established relation and I know them in person. So we can utilize this opportunity, and given that we are already in progress with 2 of the projects, we can interact and try setting meeting if that is one possibility. So I can talk with Priyanka and Siddharth offline about how do we create a list and the ways to connect with them, and also some government official like at the level of district administration, I'm aware, but if there's a requirement of the state government, then I can figure out that possibility also. Yeah.
That's great, Neha. Thank you so much.
Great. So if there are no other comments, I think we'll just thank you again for your support, for your time, for your energy and drive to make it work, because collectively, we'll hopefully meet our target of raising another 50 lakhs and getting project SWAS completed, also project Rozgar going. We had a very good meeting just now, a call with some other partner organizations that are doing some really tremendous work at the very grassroots with actually finding employers, finding workers and matching them. And they're very keen to work with us as well. So hopefully we will actually be able to again deliver on a very challenging project which has so many different aspects with Rozgar, and we'll keep you posted and look forward, hopefully once this situation improves, that our next meeting will be face-to-face, since most of you are Delhi based. Yeah, thank you, and speak to you soon.
Thank you.
Thank you.
Bye-bye.
Bye, guys.